Hey everyone, it's Alyssa, and some of you might recognize me as an ambassador with Purple Day Every Day. And I'm super excited to go ahead and introduce the next session created by Partners Against Mortality in Epilepsy about Sudep. I had the chance to go ahead and sit in on a panel, and this subject is so important, and I hope others recognize that as well. I learned so much from others on the panel, and I hope you get to do so as well. Sudep is such an important issue, and we need to speak up about it and start talking more about it. So let's go ahead and dive in and get to talking about it, okay?
My name is Tom Stanton, and I'd like to welcome all who are watching during the Purple Day Conference for this informational session on the topic of mortality in epilepsy. Epilepsy, as you all know, is a disease that impacts so many people, and one of the most challenging aspects of treating it is that there is a huge spectrum in how it presents itself from one person to the next. One thing that everyone who copes with seizures has in common is that they deserve to be educated and counseled about the most serious risks that accompany epilepsy. To that end, part of our job as advocates and providers involves informing patients and caregivers about the risk of sudden unexpected death in epilepsy, or Sudep, which is one of several ways that epilepsy can be fatal. Sadly, according to the National Institutes of Health, Sudep is the leading cause of epilepsy-related deaths. With that as our backdrop, I'd like to introduce the panel of people who are here with us to share their perspectives. As I mentioned, I'm Tom Stanton, and I serve as the executive director of the Danny Did Foundation, which is a Chicago-based nonprofit that was established after the sudden death of my nephew, Danny. And for the parent and advocate perspective, we have Gardner Lapham.
Thanks, Tom, and thanks for having me here today. It's a great opportunity to shine a light on this really important issue. I fell into this actually 13 years ago this month after my firstborn child, Henry, died suddenly from a seizure. He was a 4-year-old boy who was just like perfect and normal in every way. And he had just been diagnosed about 5 weeks before he died suddenly. So it was... there was very little time for us to learn anything about epilepsy, let alone Sudep. And so since this time, I have worked with a number of epilepsy organizations to try to drive answers to why does Sudep happen and how can we prevent it and how can we increase awareness around this issue. So we'll talk more about some of those resources out there today. But I'm thrilled to be here and as I said, shed a light on this topic more. Thanks. Am I passing it over to Elizabeth, or how are you doing this, Tom?
Sure. Yeah. Thank you, Gardner, and thank you, Tom. My name is Elizabeth Johnner, and I am a pediatric epilepsy specialist and child neurologist at the Hospital for Sick Children in Toronto, Canada. I direct our epilepsy program here. I have been working in the area of Sudep research and advocacy for more than 20 years. Really so incredibly privileged to work with Gardner and Tom and others like them that have both experienced loss and been able to really motivate themselves to work in the advocacy realm. So among my other work, I study Sudep specifically in children and also within all people with epilepsy, trying to understand what some of the risk factors for Sudep is, and also spending a fair bit of time trying to figure out when, why, and why not do doctors talk about Sudep with their patients and families who are affected by epilepsy. I guess we can meet Alyssa now.
All right. Hi, everybody. And I want to thank you for having me today. And I also, my heart goes out to those who have lost loved ones and friends to epilepsy. I cannot imagine losing my daughter to that. Thankfully, she has not been diagnosed with it. I do have epilepsy. I was diagnosed at age 17. It was hard for me, mainly because I didn't have anywhere to turn to at that time. I grew up in a small town and moved to a small town. And now I have a family of my own, a 16-month-old daughter, and call him a toddler. He's a English bulldog, and he's almost 2 years old, so it's fun. And I also am an advocate for the Purple Day Everyday Foundation. And then, so I started a huge thing going on last year. I got myself extremely busy with becoming an advocate. Decided to start my own business in photography, and then started a part-time job. So everything got really busy really fast, and I really enjoy starting to become an advocate because I was able to spread the word about epilepsy and become involved with my community, and ended up finding out that there are children here in the school system that do have epilepsy and they don't have anywhere to turn to, like I didn't have anywhere to turn to. And we here in our town have to drive 5 hours at the minimum to see a neurologist because we're kind of in rural Kansas and have to go all the way to Wichita, Kansas. Or you could try Oklahoma, or you could try Texas. So your options are very limited, and I've been trying to figure out what to do about that as well. So that's kind of a little bit about me.
Thank you, Alyssa, and thank you everybody for joining this important conversation. And we're really lucky to have this range of perspectives to contribute. But I kind of want to start with a big picture overview, if that's okay, Dr. Donner, just to talk about what is Sudep.
Thanks, Tom. It's Elizabeth, but thank you, Tom. Sudap stands for sudden unexpected death in epilepsy, as you know, and really that describes what it is. So Sudap is the sudden and unexpected death of a person who's living with epilepsy. What we mean by that is that that the person dies unexpectedly, and most often people are found dead in bed in the morning. Often, but not always, with some suggestion that there's been a seizure before they died, either from the posture of their body or because, it looks like they bit their tongue or something like that. Sudap affects about 1 in 1,000 people with epilepsy per year. We used to report that Sudap was about 10 times less common in children under the age of 16 or 18. But more recently, my group and a group from Sweden have demonstrated that it's equally common in children and in adults. And we know it's even more common in people who have uncontrolled seizures, particularly people who have uncontrolled or frequent generalized tonic-clonic seizures or full-body shaking seizures, what we might call convulsive seizures. Also more common in people who have trouble following the directions of their healthcare providers with their medication or other ways to treat their epilepsy.
That's really helpful. Thank you, Elizabeth. And I want to ask you, Gardner, after your experience with Henry, is there any advice that you would give to a parent or to an adult patient about questions to ask their doctor when it comes to Sudap?
Yeah, definitely. And times have actually changed a lot. When Henry was diagnosed with epilepsy 13 years ago, as I said, it was definitely not discussed. Very little was known. It's a more of a mainstream issue now, and doctors are much more aware of it and understand risks and prevention strategies more. So there weren't a lot of answers to questions back just a few years ago, but now I think it's super important that three questions. I think there are lots of questions around epilepsy, right? But around Sudap, I think there are three really important questions. One is, what's my risk or my child or loved one's risk of dying suddenly from this? How can I reduce this risk or my child's risk? And then if I or my loved one has nocturnal seizures, how can I make sure that I am staying safe at night and getting the care I need during and after a seizure? I think those are the three most important questions around SUDEP. Elizabeth, would you add anything else?
I think that those are excellent questions. One thing I would add is just to clarify what nocturnal seizures are, because I've had a few people have misconceptions about that. That doesn't mean you have like a special type of epilepsy that only happens at night. All it means is that the seizures that happen sometimes happen at night. So it just means, do you have seizures at night? And we know, and thanks for bringing it up, Gardner, that people that have seizures at night or in bed or while sleeping are also more likely to die of SUDEP. So that's another very important aspect.
And then beyond those three questions, Tom, I think it's important for people to ask their doctors, what do I do if I've forgotten to take one of my anti-seizure medications? How can my friends and family help? What resources are out there?
Yeah, I think highlighting what else can I do to take care of my seizures, to treat my epilepsy is really important, because we know that there are some people who would benefit from other types of treatment for their epilepsy, such as epilepsy surgery, who don't get referred and to the right type of epilepsy center. And so, when I hear that Alyssa lives in an area that's kind of relatively underserviced with regards to neurology, I know that there are a lot of people around the world in that position. And so sometimes it does take the person with the epilepsy or their family to kind of push the envelope and say, is there something else we should be doing? Should I be evaluated for a surgical treatment? Is there another way we could be treating this epilepsy? Is my seizure control good enough? And we can almost always do better.
That's great information. And it makes me wonder, Alyssa, in your experience, did you initially hear about SUDEP from a neurologist? And if not, how did you come across this topic?
No, I did not. I was diagnosed 13 years ago as well. So I had no idea about SUDEP. I was diagnosed with juvenile myoclonic epilepsy, and I think that I need to be re-diagnosed. But I haven't had a tonic-clonic seizure since November of 2018. And the thing is, when I was having so many tonic-clonic seizures, my husband was concerned that I was having seizures at night. And so then looking back now, I wonder if I was at risk for SUDEP. And so I had no idea about SUDEP then, because I didn't even know anything about it. And not having resources to turn to, no epilepsy centers that were around me. I was in Colorado at that time, and I'm sure I probably could have looked it up, but no neurologist really informed me of anything of such. And so not being able to discuss it with others, because I didn't have anybody around me that had epilepsy or any friends that really understood it enough to, they were comfortable with it, that I could talk to about it, kind of made it even more difficult for me to come out and say I'm okay with epilepsy. So it took me almost 5 years to be okay and say, yes, I have epilepsy. And it actually was my husband who was the one who pretty much forced me to say it, because he's like, all right, our relationship isn't going to work unless you talk to me about it. So when it came to SUDEP, he didn't even know anything about it either. And he asked me, well, are you having seizures at night? And I was like, I have no idea. And he said, well, your teeth, you chatter a lot. You're grinding your teeth a lot. And I said, well, I might just be grinding my teeth. I don't know. He said, you're under a lot of stress and you've had multiple seizures within a couple of weeks. So, and we went to the neurologist and they never mentioned anything about it. So now when I talk to the neurologist, they say, well, you're not really at risk since you haven't had any tonic-clonic seizures for the past 2 years. So it's still like kind of out there, but at the same sense, it's like, well, do I need to be reassessed? Or because I have absence seizures, but we're trying to figure out if there's a different route to take to get those under control. So,
can I say something, Tom? Is that okay? Because I think Alyssa, like some of the things you said resonated so much with me because you were really talking about the stigma of epilepsy, right? And and epilepsy has a tremendous stigma that goes back many years and is prevalent in many cultures, and it makes people not want to talk about the fact that they have epilepsy. And I think that silence that we have around epilepsy has extended and amplified into a silence around Sudap. And so nobody wants to talk about epilepsy. No one wants to say they have epilepsy. No one wants to talk about the fact that you can die from epilepsy. And if one of the messages that we want to send about epilepsy is that it's kind of okay to have epilepsy, it's hard to also have the message at the same time, but actually it can be a very dangerous disease and we need to consider that too. So it becomes very, very complicated. And I really appreciate you kind of elucidating that in your comments.
of course, yes. And that's another thing, like not just like talking about like Sudep, but also the infant spasms.
Infantile spasms, yeah.
There you go. I think I was just a little mama bear when she was just itty bitty because she was a premature baby, and so I was just overbearing, probably thinking, "Oh my God, was that a seizure or not?" And I was afraid that maybe it was, maybe it wasn't. So I'd be asking my husband. I'd say, "Watch this video." He'd be like, "No, she's just stretching," and he's like, you need to just relax.
Yeah. Well, I hope we can, I just hope we can find ways to talk about epilepsy in a positive light and also recognize the risks so that we just bring out everything we need to know and everything we need people to know.
Oh yeah. And like on Instagram, when I do videos, when I try to talk about Sudap, and I did a short video because I'm not like a pro at knowing everything with Sudap. And I had a couple people talk to me about it and question, and then a couple people, thank me about it. But I definitely wanted to let them know, hey, I'm not, expert in it. I definitely want you to do some more education for yourself and understand more of it, because I think everybody needs to look into it. And if there's families out there that need help, I always try to encourage them to go ahead and message me so that they have that support as well. But I think it's all about the support groups too.
I think Elizabeth, the experience of Alyssa makes me kind of remember or think about, how a lot of providers struggle with this discussion, and it's challenging to approach. As someone who's been doing this for a long time, do you have kind of tips or your approach to share about how to have this conversation with caregivers?
Yeah, from the healthcare provider perspective, Tom, it's hard. And the other thing I was thinking about when Alyssa was talking was the fact that she said that she has a diagnosis of juvenile myoclonic epilepsy, and we know that that's a kind of epilepsy where people have seizures, but they're otherwise pretty healthy without any real other problems. And people maybe used to think that Sudap only affected people who were really sick with their epilepsy, who had a lot of other problems, if it's problems walking or talking, things like that. And we know, that that's not the case now, that Sudap can affect anybody who has epilepsy. So, Tom, I have a few ways that I kind of enter into a conversation with families. And of course, this is all kind of a bit predicated by the fact that I work with children with epilepsy. So I'm usually talking to parents or adolescents and teenagers. But one of the easiest ways, I think, for a doctor or a nurse to bring up Sudap with a family is just to say, because just to say, a lot of people who see their loved one have a seizure worry that they were going to die. And is that something you were worried about? And if it is, I'd like to talk to you about it, and then go ahead and give them the facts. Because for any of you that has seen someone have a seizure, it's really terrifying. And if it's someone you love, it's just crazy terrifying, right? And it's almost like the elephant in the room. And sometimes I say that because I know families want to ask me about it, but no one even wants to hear the words come out of their mouth, right? And so that's one of the big ways that I enter into that conversation. Some of the other times are when seizures are not well controlled, and I'm worried that the risk of Sudap is higher. Then I say, the reason we need to get these seizures under control is not, or try our best to, is not just for reasons like not wanting to have a seizure in the workplace, or not, teenagers have jobs, they don't want to have a seizure at work, they don't want to have a seizure at school, or they want to be able to sleep over at their friend's house, or the mom wants to be able to send the kid to grandma's house to sleep, but grandma's too scared. It's really, or maybe people trying to keep their driver's license, right? It's not just about that. It's about reducing the risk of an unexpected and premature death. And I think that's another way. And another big time is at times when there's life transitions. So, for example, when kids are going to move out and go to college, and maybe thinking about what kind of are they going to live in residence? Are they going to have a roommate? What kind of supervision there's going to be for their living environment, not just around safety at night, but also around taking their medications, right? Or maybe they're moving out into their own apartment. Maybe young adults are getting married or moving in with someone. I think those are times to talk about risk. And also for sure in times when families, either the person with epilepsy or parents of children with epilepsy, are feeling reluctant about some of the treatments and either having trouble sticking to prescribed treatments or are feeling reluctant about starting those treatments. I think we need to be really honest about why we're trying to control seizures.
That's great. That's great information. And I think provides a lot of kind of entry points, if you will, to have the discussion, because, Alyssa's comment about, she was diagnosed at one stage and now her seizures have changed. And that's a common experience for people with epilepsy. And think about the intervals at which the information is shared can be really important too, for parents and for patients.
Right. That it's not actually just one discussion or the discussion,
Yes.
Risk is dynamic and changes over time. And so I like, Elizabeth, a lot how you talk about, needing to have these discussions over time and as life situation changes and how the epilepsy changes and how well it's controlled.
Yeah. And I think, one natural kind of extension of finding out about this risk is what can we do about it, and how can we push back against it? How can we advocate in some fashion? And obviously, the really hard, tragic scenarios are when you lose somebody and you become an advocate, and that's obviously what Gardner has done, and other families that we've all come to know. Gardner, do you have any thoughts about advocating around Sudap, whether your a loved one has epilepsy or whether they've lost someone to epilepsy?
Yeah, I think about this a lot. Early on after Henry died, I knew somewhere in me that I had to get involved and find some kind of meaning in my loss and give my suffering some kind of purpose. And I guess I hoped that, my actions, whatever they were going to be, could somehow honor his legacy, and that the idea of turning something positive out of this horribly tragic situation inspired me then, and it inspires me still today. And I think advocacy I think of it very broadly, and it can be many things. I think the first most important thing I think is that we all have to figure out how to be self advocates, right? And ask the right questions, and ask questions of multiple people, and seek out those resources and understand issues. And then I think there's so many ways to become an advocate for the cause. And the best, I think a great way is what Alyssa's doing, is sharing her story and being vulnerable and open, and using social media or the press just to get that awareness out there. I just think you never know who you're going to touch or who you're going to inspire. And that's so important. And that's on us, those who've lost people, but those living with epilepsy are so important in getting this story out there. And then there are other ways, Tom, like, we do what Danny did. There's, partner with organizations to help support these organizations so that they can fund research, they can fund devices, they can spread awareness. The Danny Did Foundation is doing awesome work. And then, we advocacy in the more traditional sense is about connecting with your members of Congress and getting to policymakers to say epilepsy research, Sudep research is really important. We're not there yet. And we have a lot to do to understand the underlying mechanisms and define better prevention strategies. So I think there's so many ways to plug into this, and we need more people speaking up.
Yeah, that's a key component is that patient voice, the parent voice. I always say there's nobody that's going to be more powerful than that person who's experienced it themselves, whatever the case may be. And I know that one thing that's really important to you and to Elizabeth and I and to others is this Partners Against Mortality and Epilepsy movement that we're all a part of. So I wanted to invite Elizabeth and Gardner just to talk about that, to tell people what it's about and how they can engage.
Gardner, you start.
Oh, well, I mean, PAME, Partners Against Mortality and Epilepsy, was founded in 2012 as a multi-stakeholder forum for education around mortality and epilepsy, and not just Sudap, right? Like there are a number of causes that can lead to epilepsy-related death. And so it's a unique partnership because it allows me as a layperson and as a bereaved mom to work with someone like Elizabeth Donner, to work with Tom Stanton. It brings together doctors and researchers and people who are bereaved, people who are living with epilepsy like Alyssa, and puts us all together to share information and help drive future agendas. And so it started out as a meeting that occurs every other year. And now we're trying to evolve our efforts and enhance our efforts. And we're launching a 6-part webinar series this year, starting in March. Elizabeth, what else?
Well, one of the really incredible things I think about PAME has been that at our meeting or our webinars or any of our activities, the people that are present include, like Gardner said, people living with epilepsy, families of people living with epilepsy, people working in the advocacy sphere, but also basic science researchers, so people working on animal models of epilepsy or working at like a cellular or a molecular level, as well as doctors and nurses and other healthcare providers and people doing clinical research. And they all get together and talk together. And there's been some incredible collaborations that have grown out of that, and also just insights. One of the things that I've heard from some of the scientists that attend our events is how amazingly powerful and inspiring it is to actually meet and hear from families that are affected by the research they do, or that their research is targeted to try and help. I think that's been really incredible. And I have learned so much from talking to families and listening to families. And it's really like relevant stuff that I'm learning that actually informs how I go out and do my clinical research about epilepsy. So I mean, it's been an incredibly powerful opportunity and experience working with PAME and being part of PAME. And we've had some really good partners as well, professional organizations like the American Epilepsy Society, organizations like Danny did, and just bringing them all together. It's been, you have to get together to make things happen, basically. And since PAME started, Gardner, we have seen a very significant change in how Sudap is addressed in the medical literature and the lay literature. So I feel like it's been positive. Not to say there's not lots to do, but I feel like it's been positive.
Well, I feel like PAME has really helped to create a community around this issue, and like you said, it's facilitated collaborations and spurred momentum. And I think there's so much still to do, but there's more of a network. It needs to be emboldened more, I think, but there's more of a network, and we welcome everyone to come and join us. And we will look to, right, Tom, you're actually leading the webinar in March. And so hopefully we'll disseminate more of that information through this forum.
Yeah. Tom, your webinar in March is about grief. Is that right?
That's right. Yeah. It's about grief and specifically grief, with folks who have lost a loved one to Sudap and how that grief changes over time, and there'll be discussion of a survey that was presented to parents who have lost loved ones to Sudap, and Dr. Jeff Buchalter is going to kind of walk through the results of that, and we'll have a panel discussion. But one aspect of PAME that's always been really important to me is, although our family was touched by Sudap and Gardner's family was touched by Sudap, mortality in epilepsy is this broad thing, and there are different ways, unfortunately, that can result in the loss of our loved ones. And I wanted to ask Elizabeth if you could just talk a little bit about that aspect of PAME, but just generally mortality in epilepsy and how it's broader than just Sudap.
Well, we know that, thanks, Tom, we know that people with epilepsy are about 2 to 3 times more likely to have a premature death than people who are living without epilepsy. And you can divide up those deaths as being related to the epilepsy or not. And while epilepsy-related deaths, Sudap is the most common cause, there are other things to consider. Like, for example, drowning in accidents, very serious problem in epilepsy. We did a little study here in the province of Ontario where I live and found that people with epilepsy were about 10 times more likely to drown than people without epilepsy. And the majority of those are happening in the bathtub, which it really, really makes me sad, because I feel like that's an obvious thing that we should be educating people with epilepsy about, that there's a lot of risk in taking a bath, and there, are safer ways. And they should be focusing on that. But I think we're probably not doing a good job of that, because so many people are still drowning in the bath. So that's one example. The other, another aspect of epilepsy mortality is accidents and suicide, and intentional overdoses and unintentional overdoses. And what that speaks to, I think, particularly the intentional overdoses, is the fact that epilepsy has a lot of comorbidity, which is I guess a fancy medical word, but just means other disorders with it at the same time. And so a significant proportion of people with epilepsy also have mental health disorders. And as healthcare providers, we need to do a better job of screening people with epilepsy for that. We could be having the same conversation with Alyssa, asking whether her neurologist, we talked about, did your neurologist talk to you about Sudap? We could also be saying, did your neurologist ask you about risk factors for depression or anxiety? Because we know these things are common in people with epilepsy, and they also can have, very dire outcomes. So those are just a couple of examples. We also, at the PAME meeting, I should say, have on some occasions spent time about deaths due to status epilepticus, which is continuous, very, very prolonged seizures that land people in the hospital. And there's a lot of nice ongoing work trying to understand how we can reduce the incidence of those very bad cases of status epilepticus.
And I'll touch on a couple of those things that you spoke about, Elizabeth.
Yeah.
Like the drowning portion. So I know the facts about drowning in the swimming pools and then the bathtubs. My first seizure was actually in the shower. And my mom, she didn't know that I had epilepsy. And she heard me hit something. She was a medical assistant at the time. And me, I didn't want to admit to my mom that, I had one of those twitches, and I just said, "Oh, I just dropped something." And I didn't know what was going on. I was like, okay, what's wrong with my body? Like, what is going on? And then I ended up having a tonic-clonic seizure in the shower. And she told me later on, she said, I pulled you out of the shower and I didn't know if I was going to have to start doing compressions on you. Because she didn't know, because of course my lips were blue, and she was concerned, you're not breathing. Are you, did you get too much water? Did you intake too much water? What happened? So that was another thing. She had no idea. Then, we went to
Alyssa, the shower can be dangerous too, because depending if your shower is like in a tub, and if someone falls and blocks the drain to the shower, then water can pool up around them. So showers can be dangerous too.
Yeah. And then of course, going into depression, anxiety, and not being able to talk to people about any of your issues, those types of things. A lot of people don't understand that part of epilepsy. People will sometimes say, you just have, you don't look sick, like you're fine. Like you just had a seizure. That's all it is. Or I've actually been told before, I went to a party with my husband, and I was told, you could just have a seizure. You could fake a seizure and go home. And I looked at him and I said, excuse me? Do you know the outcome and what seizures do to people? And he was like, well, you can. And I just walked away, because you can't really explain that to people, make them understand if they don't want to. And so then that plays a thing in your brain. Like you're a little messed up after that.
Yeah.
And you go home and you think about it and kind of go into depression mode again, because people just don't understand. They don't want to understand, or they do want to understand. You don't know. And then doctors, when you go to the doctor's office, the medical assistant will go through the list. Have you been depressed? Do you have anxiety? Do you have this? Do you have that? And you go, do you say yes or do you say no to the medical assistant?
Yeah.
Because, well, yes, I have this sometimes, but no, I don't have it all the time. Yes, I have anxiety. And then you don't know if they're going to think, okay, this person's crazy. Do we need to put them in the crazy bin or not?
That's the stigma thing talking again, though, right? Geez, now we're talking about two of the biggest stigma disorders out there: epilepsy and mental illness.
Yeah, it exactly
is tough.
Yeah. So
thank you for your honesty about all that. That is so tough.
Oh yeah. You got to be honest in order for doctors and everybody else to understand and come together. So.
Yeah, I think it speaks to the need across all of these spectrums for communication, for doctor-patient communication, for the patient to be honest with their family members. In your case, you're talking about your mom and the relationship with her and her knowledge of your epilepsy. And it really all stems from that communication and to Gardner's earlier point, just awareness, awareness of what is epilepsy. And then, it's attached to this thing called Sudep, and all these different conversations that need to be articulated, I think are so important. We've had a great discussion here with the four of us. And we were also able to get a bunch of questions from patients and families in the epilepsy community. So I wanted to dive into those and kind of toss them out to you guys, if that's okay. So I'll start with one that we got that asks, and this is a pretty common one actually that we get at Danny Did. I know, says, I've been told by my doctor not to worry about Sudep. Do you have any suggestions about how to approach them on this subject? And I know Gardner gave some tips, but I wonder, Elizabeth, if you could speak kind of directly to that scenario where there's maybe a minimizing of the risk for the family.
Yeah, I'm curious, like what other people think about this, because I haven't been on that side of it. But one option is to actually maybe arm yourself with the guideline from the American Academy of Neurology, actually, that recommends that doctors talk to their patients about Sudap. Now, it can be hard on healthcare providers when families walk in with a list of things they've Googled. So I'm cautious about making that recommendation. But the American Academy of Neurology is a very well respected, established institution, and most doctors, most neurologists would follow the guidelines of that organization, or be aware of the different guidelines they have. So you can get that. They make if you go to that website, they have a like a patient handout that basically says that, and just coming in and saying, I really want to talk about this. I don't know. Tom, what do you say when people ask you that?
Yeah, well, I mean, I guess the first thing I say is that, starting from that premise that it is totally natural to worry about the prospect of your loved one dying, and that the reality or the baseline is that you are worried about it. You've heard about it from one source or another, and now you want to turn to your trusted kind of confidant in your provider to help give you information. And so I think the acknowledgement on both sides of the equation is just the important starting point, that this is a thing, this is a real thing, unfortunately, that our epilepsy community deals with, and how can we talk through some of the ways to both cope and minimize the risk. I think that is kind of the best approach that we can suggest. And just to relay or remind, our providers that, they have such a great opportunity to build trust and to encourage open dialogue, through this conversation. And so kind of looking at it as a way to engender, the best possible care is the way that might make them feel more comfortable.
And I would just add, that's really good, Tom. The issue of nocturnal supervision, I think, is a particularly challenging one for those that have, seizures in the nighttime. And if you're a parent with a kid that has these kinds of seizures, I think it's a conversation you have to push. There's not a straightforward answer. And I don't know, Elizabeth, do you want to add anything there? Because there are devices. This is what Danny does is talk about what is out there and what might be the better fit for a family, but it's tricky. And I often worry that conversation's not being brought up enough either.
Well, what we can talk about nocturnal supervision, but just before we get to that, I think something came up in my mind when Tom was talking. I think one of the ways also to encourage your health provider to have the discussion with you is to bring it up at the beginning of the appointment, or to ask if you can book another appointment to come back and talk about it. Because one of the things that sometimes happens in appointments is, the doctor has set aside however long it was supposed to be for the appointment, 15, 20, 25, I don't know, half an hour, whatever. And if something complicated like that comes up at the end, it's possible that they just don't feel that they can approach it in the proper way in the right amount of time. So saying, I want to talk to you about this. Do we have time to talk about it today? Or can I book another appointment and come back and talk to you about it? That might be one approach. With regards to talking about approaches to kind of nighttime surveillance for people with epilepsy, that's a complicated topic. And I know Tom is an expert in this as well, because Danny does a lot of work looking at the different devices that are available. I think it's a conversation to have with the doctor, and you can ask them specifically about devices or resources. But I usually refer families. I know a lot about the devices, so I talk about them themselves. But I do use the Danny Did website as a place where families can go to read more. Go into that conversation armed with some information of your own. So if you're wondering about the different kind of seizure monitors, the first thing to say is we don't know that seizure monitors actually saves lives. What we do know about seizure monitors is that depending on what type of seizure you have and depending on what type of monitor you get, they may be good at alerting when a person is having a seizure at night so that someone can go and help them. And if you read about the different seizure monitors before you go into an appointment like that, then you can actually have a conversation with the doctor around, does that monitor fit my kind of epilepsy or my scenario?
I think that's a great bit of advice, and just making sure there's an alignment, right, between what is it that we're experiencing ourselves and what is it that the device proclaims to do.
Yeah.
And how do they fit? Because we talk to families all the time, and I'm sure everybody has experience with this, where they've tried so many things, whether it's medication or diet, sometimes even surgery, and they're still facing these challenges, and they become really kind of desperate for the next thing. And I think as advocates, part of our job is to help them just kind of slow down and say, let's think this through, as much as hopeful as it may be to say, hey, there's something new out there.
Yeah.
Let's take a real honest look at how it fits for us. And that kind of segues into one other question we got from a dad was basic question. He said, my son's seizures are nocturnal. How do I keep him safe at night? And this kind of speaks to, this experience of parents either doing bed checks or co-sleeping, trying to use a baby monitor, any number of things. But I think this is where we at Danny did think, okay, let's look into some of these devices as complementary support systems to, certainly if there's movement involved, to provide some kind of an alert. To the idea being that somebody could be present, and if someone's present, there likely could be a better outcome for their, the opportunity to do a well-being check.
Yeah.
Anybody want to comment on that kind of scenario at night?
That's the scariest for families. Go ahead, Alyssa.
I was just thinking, what about those owlet devices that are for babies that they put on their feet?
Mm-hmm. Yeah, so I mean, there's a lot of different types of devices. There's devices that register movement, like movement of the body, devices that register heart rate, devices that even there's some things that work on sweat levels and skin sweat, things that look at the oxygen level in the blood. And you need to kind of pair up what it measures with what the person does when they have a seizure, and realize that there are some seizures that wouldn't be picked up by some devices. So anything can be helpful, but that's really the discussion to have with the doctor. So what I do is I tell families, go to the Danny Did site, read this stuff, here's some stuff to look at, and then come back and let's talk about it. And include with that conversation, right, Tom, the cost of some of these devices. Some of them have some different types of monitors, including monitors that even aren't designed for seizures, but are just designed for kind of fancy baby monitors, have yearly subscription fees. So there's different types of costs associated.
Yeah, that's important consideration. And I just, maybe as a closing thought for this topic, I just want to mention that one of the things we do at Danny Did is to provide grants to families who have identified a system that could be helpful, or they think could be helpful in their scenario, and they're lacking the resources to get it into place. So if there are folks listening who want to learn more about devices or could benefit from a grant, you can certainly go to dannydid.org, and our application is there if anyone wants to check that out. So I think we're coming up on our time here, but I want to just kind of throw it out there. If there's anything else, closing comments or observations that anyone wants to make. I super grateful for everybody taking part in all the work that you do in the community. And Alyssa, it's been great to meet you and to have your voice a part of this. So thank you for joining us as well. Any closing thoughts?
No, I'm just grateful for the opportunity. You know, Purple Day every day. It's wonderful that that people are listening to this and want to know about this topic. And back to that issue of stigma, right? Like, if we're afraid of this, we won't make progress on this. And you know, we have to talk about it to get over our fears. And this is a first step. So it's really, thank you for this opportunity to talk about it.
I agree, Gardner. And people could go and look up PAME, PAME, Partners Against Mortality and Epilepsy, and join some of our educational events to learn more and hopefully feel more comfortable about the topic.
PAMEonline.org.
Thank you, Gardner. PAMEonline.org. Okay.
Yeah, great. Well, thank you guys. And for those of you listening, you know, you're not alone. If you have questions, if you have needs, there are resources out there for you. Please reach out and don't hesitate. And hopefully we'll see you through the next PAME meeting in March.
Yeah.
Thanks so much.
Nice to meet you, Alyssa.
Nice to meet you, Alyssa.
Good to meet you, everybody. Thank you.
Sudep can be a difficult topic to talk about, and we want to thank Partners Against Mortality and Epilepsy, also known as PAME, for bringing us that session. That was so powerful. We encourage you to talk about Sudep any chance you get. It is so important.